morning, students. Hello. Good morning. I want I want reply from all of you. I am having your list. So today's session. Very good morning. Good morning. Yes. Wonderful. Wonderful. Happy to see many replies. So, so today's topic is ethics and professionalism. So most of the things will be covered when you come to second year MBBS. So today we are going to discuss in superficial aspects. So that too, I will be trying to extract the information from you people. So rather than me talking and me reading the PPTs, it is you who is going to explain, who is going to tell some of the examples. Is that okay? Okay. So I would like to congratulate all of you for selecting our profession, that is a medical profession, which is noble profession, that too in our college. So can anyone tell me why it is called as noble profession? Arun B, are you there? Very good. So you please tell me why it is called as noble profession. Yeah, you tell your perspective. You may be wrong, you may be right. See, we consider you are just passed your plus two, no problem. You just tell me why it is called as noble profession according to you. Serving the people and society. Yes. Okay, okay. Thank you, thank you. Itashri, are you there? Itashri, Prachi Yadav. Yeah, please tell me. Okay, thank you, thank you. Kawana BH, can you add? Yeah, please. Okay, okay. Vidya, we. Yeah, please tell me. Yeah, yeah. Profession. Okay, okay. Shreya Singh, please tell me. According.
Consideration of our own needs. We keep
Okay,
them before ourselves, so it's noble.
noble profession. Yeah, yeah. So ours is noble profession because the other people tries to follow us or they try to admire this profession. That's why this is known as noble profession. So now my next question is, what are the other professions which are called as noble profession? Sneha, KM. Sneha, are you there? You are not audible. Rishita R.
Yes, sir.
Yeah, please tell me what are the other professions which are called as noble professions?
So, like many other, we can consider even soldiers as that. It's not
Yes.
a profession; it's a passion.
Yeah.
So, I consider soldiers,
Yes.
farmers,
Yes.
and many more.
Anymore. Okay. So that's why it's called as noble profession. And my next question is, why do you all choose this profession? So this is Deepa S.
Yes, sir.
Why did you join this profession?
I want to serve society, so
Society. So there are so many professions, no? You can serve the
and
society.
I'm interested in this field, sir.
Okay, okay. Pramod Kumar.
Yes, sir.
Yeah, why did you join this? What made you to join this?
Sir, to serve our community and to
Okay,
relieve the pain of others,
okay.
and sir, to study human body is
Ah,
fascinating to me.
okay, okay. So very good, wonderful interaction. So we'll see what is ethics now. So ethics is, so this deals with moral principles which should guide the members of medical profession in dealings with each other, with state and with other patients. So in simple words, it is doing right thing. Okay. So there is one more word known as unethical. So it is opposite of ethics. So ethical and unethical. Doing right things is known as ethical, and doing wrong things is known as unethical. So in a simple words, I am telling you. Is that okay? Yeah.
Yes, sir.
Yeah. Yes, sir.
Yes. 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 Okay. So now we will discuss one by one regarding the unethical acts. So that is known as serious professional misconduct, or it's also known as professional malpractice. So I want you to tell me some of the examples which you are not supposed to do. Understood? So think of any act, any conduct, any behavior of a doctor which he is not supposed to do. So I want answer from each one of you so that I'll get more than 70 examples. Is that okay?
Yes, sir.
Yes, sir.
So I'll be asking one by one. We will discuss each examples. So I'll ask Madhu Pandey, are you there? Madhu Pandey.
Hello.
Madhumala.
Hello.
Yeah. Oh, is it Madhumala?
No, Madhu Pandey.
Madhu Pandey. Yeah, madam. Please tell me. Some of the examples, so many examples are there. You tell me one example which you are not supposed to do, being a doctor.
Sir, there are many things which we are not supposed to do.
Yeah, you please tell me
First
one
of
among them.
Okay. First thing is that, see, since we are a doctor, so we need to uh, serve the patient with dedication, and
Yes.
we should understand we should not do it for money, and we should not give less time to a patient and just remove that no, this is done, because many a time patients they want us to give 100% care, and
Okay.
if we don't give them time, and we just want so that many patients should come, and we want money. So if we are in a clinic, then sir, I've seen in my society that people want many more patients to come, and they don't treat each patient uh, in a good manner. So
Okay.
first of
So,
all, I think we should.
so you mean doctors should not be money minded. So you should
Yes,
not be greedy. Okay.
yes, sir, yes.
Yes. Thank you. Meghana M. Yeah. Tell me, madam.
Yeah, so a doctor shouldn't be rude to the patient. He shouldn't be arrogant, and he shouldn't discriminate patients on basis of anything like caste,
Wonderful.
religion.
Wonderful. So we should not discriminate on the basis of caste, creed, religion, sex, behavior, and nationality. Wonderful. Next, Nikhil M. Nikhil M. Pankaj Sirvi.
Yes, sir.
Your name is Pankaj Sirvi.
Pankaj Sirve, sir.
Yes, sir. Please tell me, sir.
Sir, the unethical things I think is breach of confidentiality. Doctor should maintain the confidentiality of patient
Yes.
and should not
So,
discriminate between patient.
yes.
Give priority to the most important person.
Anyone. You please give others the chance. So you mean to say we should maintain the confidentiality. Whatever the information we gain from the patient and the attenders should not be revealed to any third person without the consent of the patient.
Yes, sir. Yes, sir.
Wonderful, wonderful. Sana Haq.
Yes, sir.
Yeah, madam. Please tell me one of the examples, madam.
He should not be selfish.
Yes.
I'm and a doctor should not let the patient lose their trust which they have in them.
You should maintain utmost trust and
From
confidentiality.
the patients.
Okay. Sharmila.
Yes, sir.
Please tell me, madam.
So according to that, the rich persons give the bulk of money to the doctors to save in their situation to prepare the false reports. So
Yes.
the false reports shouldn't be given.
Yeah. So you mean to say we should not issue false certificates, right?
Yes.
Yes. Issuing false certificate amounts to professional misconduct and punishment will be given to a doctor. So
Yes, sir.
I'll be telling what is the punishment and all in the later stage. Thank you. Shreya KR.
Thank you.
Shreya KR. Pavan Yaraddi. Yeah, tell me. Yeah, I think she has told we should not discriminate. So that means we should give equal priority. Any other example which you feel? There are so many examples. Just think of like very good. We should not do illegal organ transplantation. So there is one act known as Human Organs Transplantation Act. So there are guidelines given by this act. Anything out of this amounts to malpractice. Okay. Naveen Talawar. Muhammad Omar. Yeah, tell. Taking more money from the patient. That she told. We should not be greedy. So you think of any other things, man. So many things are there. Just think of a doctor who should not supposed to do some of these acts. So in Kannada they say, hey, ಇವನು ಡಾಕ್ಟರ್ ಅಂತಪ್ಪ ಇವನು ಹೀಗೆ ಮಾಡಬಾರ್ದಿತ್ತು ಅಯ್ಯೋ ಡಾಕ್ಟರ್ ಅಂತ ಇವರು ಹೀಗೆ ಮಾಡಬಾರ್ದಿತ್ತು. If the same act is done by some of the other professions, they wouldn't mind. But if it is done by a doctor, they highlight this. So those things I am asking. Do you understand? Yeah, if the same act is done, say for example, by a layperson or by a carpenter or by an auto driver, so they wouldn't mind it. So if the same thing is done by a doctor, they mind it and they highlight this. So that act I am asking for. Please tell me. Discrimination, it's been discussed. Kavana BH. Kavana, please tell me. Tell me. So even in emergency, you are not supposed to consider your personal things. You should dedicate yourself and serve the patient. Jayachandra. Ah, very good, very good. So it may be anything. You are not supposed to take revenge. You are not supposed to be involved in the torture or involving the physical harm to the patient, whatever may be the circumstance. Jahnavi Kulkarni. Jahnavi Kulkarni. Prithvish Nyamati. Yes, sir. Tell me. Same thing is being discussed. It is discussed. You think of any other things? Yes. You should not maintain. You should maintain utmost dignity and respect. We should not use vulgar words. Very good. Sannidhi JP. Shraddha Prakash. Tell me. Medical negligence should not be there. Okay, negligence part will be taken in the next hour between 11 to 12. You forget about the medical negligence as of now. You tell me some of the acts which is not medical negligence, which is not supposed to be done by a doctor. Okay, you are correct. Okay, okay, fine. Sakshi, SR. Yeah, you are audible. Very good. Okay. So, however may be your experience, you should go on learning. You should go on gaining the knowledge. Okay, okay. Sahana GS. Nagashri. Nagashri. Yeah, you are audible, madam. He shouldn't be an irresponsible. So, you should be a responsible person. Okay, okay. Shreya Singh. Are you there? Please, please, please. Okay. So whatever is there, that should be explained clearly to the patient in his own language and to the attenders. Is that clear? Saubhagya? Tell me, madam. Okay. So we should be skillful, and if we are not having skills, we should not perform. We should not do experiment. Good. Shrujana R.
Yes, sir.
Can you add? Yeah, yeah, you are audible. Beautiful. Yes. Tell me, tell me. Yes. So you are, see, there is one act known as Preconceptional Prenatal Diagnostic Test Act. So guidelines have been given by this act. So anything out of this, So if the doctor is if the doctor is going to do ultrasound, and if he is trying to kill the the fetus which is female, that amounts to female feticide, and that amounts to professional misconduct. Very good, wonderful. Tejas, are you there? Vidya? Yeah, please tell me, madam. Tell me some of the examples. Okay. Okay. So unnecessarily you should not give the anxiety. So whatever is there, you should explain. Is that? Okay. Abhishek Agarwal? Abhishek Agarwal, are you there? Anjali? Ashok? Yeah, tell me, Ashok. I did not understand. Can you please repeat? Yeah, yeah. Yeah. So discrimination, it's been discussed. Thank you, thank you. Karthik MR, Mayuka. Yes. So yeah, it's been discussed. No. So we should not be money minded. So you tell me. So there are so many examples. Just think of. I'll give an example. So can a doctor come to a patient after drinking alcohol? Yeah, you go on telling. So it gives. Yeah, you tell me regarding this. Yeah, yeah. Okay. So we should not attend the patient, or we should not do the surgeries or any procedures under the influence of alcohol. Is that okay? Nikita. Nikita NA.
Sir, Nikit Yanni, sir.
Okay, sorry. Nikit NA. Tell me.
Sir, the doctor should maintain the hospitals in a hygiene.
We should maintain hygiene. Okay. Pooja.
Yes, sir.
Can you add?
Sir, the doctors.
No. Yes, sir. The doctor should be kind and honest to their colleagues also, not only with their patients,
Yes.
with also with their colleagues, and they should not be arrogant with them.
Okay. So we should be friendly, you mean to say.
Yes, yes,
And we
yes,
should
sir.
respect each other. So you
Yes,
respect your friend, and in turn they will respect you.
yes.
Prachi Yadav,
Yes, sir.
can you please tell
Sir,
me?
sir, almost all the uh, things that have been told by the students, but I still think that a passive shouldn't be a doctor shouldn't be a passive listener.
Doctors shouldn't be.
A passive listener. He should always take the patient into his confidentiality, I think.
Okay. Pramod Kumar,
Yes, sir.
can you please tell me any
Sir,
other
he should,
example?
sir, he should do the proper counseling of the patient.
Okay.
Sir, means the patient should know the disease he's suffering from, and should know that if he's going from any surgery, how much time will it take to recover from it, and should know all the things that is related to.
Okay. Rupesh, Rupesh, Shashank MS, Shrutika,
Yes, sir.
Shashank.
Yes, sir.
Shashank, tell me.
Sir, doctor should be truthful, sir.
Truthful. Like how?
Yes, sir. Means the patient is having a fever, but the doctor tells him that you are having a brain tumor or something, some other else disease,
Yeah,
and
he should
he
not. He should not unnecessarily tell them wrong diagnosis, and he should not try to extract money.
yes, sir.
Right?
Yes, sir. Yes,
Okay.
sir.
I'll tell you one more example. So the doctor should not have any sexual relationship with the patient or patient attenders.
Yes, sir.
Fine. Arun,
Yes, sir.
Arun B.
Yes, sir.
Tell me the other example.
Sir, the doctor should not give false hopes to the patients, sir.
Okay.
They should not have false hopes that they will be alive or they will cure the disease like that. If a patient had AIDS, so it is uncurable now, sir. The doctor
Yeah.
should not tell him that it is curable and you will be get soon. He will get well soon like that. He should not give false hopes to.
Yes, yes. Whatever is there, we should explain that. We should not give unnecessary explanation regarding the prognosis. Okay.
Yes, yes, sir.
Vikas, BM, Vikas, BM, Bhavana.
So doctor should maintain the confidentiality of the patient.
Confidentiality we have already discussed, right, madam? Any other? Think of anything which are not discussed. So I'll tell you one more thing. So doctors should not advertise himself. Do you agree?
Yes, sir.
So you should not put unusual large signboards. Fine.
Yes, sir.
Chetana, Chetana,
Yes, sir.
can you please tell me?
Sir, a doctor must not be in
You are not audible. Ishwari,
Sir, a doctor cannot be impatient or egoistic. He must maintain his EQ to all different kinds of patients.
okay. So I'll tell one example. So doctor should not be involved in criminal abortion. Do you agree? So there is one act known as MTP Act. So guidelines have been given by this act. Anything other than this amounts to criminal abortion, and we should not be associated with this. We should not procure this abortion. Do you agree? GS Rahul?
Sir, can you hear me, sir?
Yeah. Tell me, man.
Sir, I mean, most of the points have been said, but one more thing that I would like to add is a doctor should be focused at most times. I mean, he should be at the top of his game. He should know that any mistake from his side can cost a life. So he should be accountable, and he should be responsible
Yes.
almost every time. So
Yes.
no mistake is acceptable from a doctor.
Okay. So, is there any volunteers who can tell the remaining examples if you
Sir,
know?
could I add something, sir?
Please go on.
So my name is Gaurav. Sir, I feel a doctor must have a killer instinct and must be spontaneous, because many times in surgery, doctor has to choose between two options,
Yes.
and then he needs to be very much sure in what he's doing. So he needs to have a knack of doing it, which comes with experience, obviously. But yeah, must have a killer instinct towards what.
Your name Gaurav. Gaurav.
Yes, sir.
Yeah. Thank you. Any others?
Sir, can I add something?
One by one. You will be getting the chance. Please tell me your name and go on.
I'm Sanjana, sir.
Yeah, tell me, Sanjana.
I feel a doctor should not practice medicine if he's not authorized to. He can't fake his certificates and gain the right to practice medicine.
Yes, even if he is, whenever, that means, you mean to say, so if he is not a doctor, he should not practice.
Yeah, I mean, if he's not qualified or if he's not got a
Very good.
certificate saying
Very
that
good.
he's
Very
a
good.
general
So you
practitioner,
mean to say, very good. Next.
Sir, my name's Tanmay. What I want to say is a doctor shouldn't withhold the treatment of the patient to meet his own budgetary.
Can you repeat it?
Sir, my name's Tanmay.
Yeah.
What I want to say is the doctor shouldn't withhold the treatment of the patient to meet his own budgetary.
Okay. Next.
Sir?
Sir, my name is Sampriti.
Yeah, tell me.
Sir, I feel the doctor should always be unbiased and shouldn't hold grudges against the patients.
Yes, he should not. He should be unbiased. Very good. Next.
Yes, sir.
So my name is Madhu.
Yeah.
Sir, I think the doctor should not smoke and he should not chew tobaccos because he is a public figure. If he is involved in such things, then it will not give a good it will not create a good impact on his patient.
Very
And
good.
at the
Very
same
good.
time, he should not write false test, because many times we see just for a normal fever they recommend so much of tests just to take out the money from the
Yes.
patient.
Yes.
So I
So
think
you
it
mean
is
to say, in front of the patient and the public, you are not supposed to drink, or you are not supposed to smoke.
even not in public, but even in private, he should not do such
So
things.
no, that is his private. See, here comes the thing. See, we have got our own rights. I can drink, I can smoke in a private. I can do this in my home, at my home, right?
Yes, sir.
And
Yes.
so see, everybody is drinking nowadays. Why we should not drink? Huh? Do you agree? You mean to say if you become doctors, you should not drink and you should not smoke?
No, but means sir, not in a bad sense. Means you are not attending patients, you are drinking, and
Yeah.
since your
Very
hygiene
good.
is not maintained, then
Very
what
good.
will the patient think?
See, that means to say you can do these things, and these things should not hamper your professional life. That means to say you can do it at your home, house. You go to pubs, you go to parties, you enjoy there, not in the hospital or not in the public, right?
Yes, sir.
Yes. Thank you. Next,
Hello, sir.
Sir?
My name is Nisha.
please, one by one.
Sir?
Yeah, tell me your name.
Sir, my name is
Yeah, Umar, tell me. Yes. So, yes. So, say for example, can you give some of the example how we are how we are involved in abatement of suicide? Okay. Okay. Yes. 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 Okay. So that is, I think you are talking about euthanasia, mercy killing. Okay. Okay. Yes. 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 Definitely, you are correct. We are not. We are not supposed to. Yeah. Wonderful. We are not going to assist any suicide. Wonderful. And at the same time, we are not supposed to order for an extra unnecessary investigations, which burdens the patient. Right. Any others? Thank you. Any others? Please. Shreya. Okay. You should not cover up the mistakes. Whatever the mistake, if happens, it should be revealed to and it should be corrected. Right? Wonderful. Next. Yeah. Yes. We should not misuse the powers and positions. Yes. Yes. Any others? Please, please go on. Atul. Amrut. Amrut. Time sense is very important. Yes. If your OPD starts at 10 o'clock, if you come at 12 o'clock, the patient will feel a different, and they definitely they are not going to come for the next time. At 10 means you should be there at 10 o'clock. Yes. Next. Mayank. Tanmaya. Go on. Okay. You should not be using unparliamentary words. Very good. Yeah. Yes. So everything should be explained. The condition of the patient, the treatment modalities available, the other alternate treatment modalities should be explained. Right? Yeah. Next. Arun, tell me. Yes. Okay. See, the thing is, so Declaration of Geneva says all the patients are, we should treat them as our sisters and brothers. Right? That means it should not be so personal, and it should not, our hand should not shake during the surgeries. So declaration says we should think that they are our sisters and brothers. Please don't get confused. Yeah, yeah, you are correct. Next. Anyone. Go on. Yeah, tell me. Yeah, you are audible. Yes, you should get updated. So whatever the treatment available today will not be there After 10 years. So it will be changed. The drugs will be changed. The treatment modality is changed. So we should go on updating that. Very good. So we should be a learner. We should be a ever learner. Next.
So that the doctor should be truthful to law and honesty. So there's many cases even are mentioned to police, but it doesn't reach there.
Yes. Yes. So we should follow the law of the land. Whatever the law is there existing, we should follow them. Very good. Next. Yeah, Sudarshan.
So the doctor should take advantage of the public and communication. Because in recent years, there are so many cases where the patient who got in front of the mistake. I mean, like all the cooperations that the doctor together talk to the patient and so on. And in this case, I thought it should be only something
Yes. Yes. Okay. Okay. Next. Yeah, tell me, Varshita. Okay. Yes. So recently you got some of the, I think one doctor was arrested for this, right, in Bangalore.
Yes, sir.
So he was supporting the illegal activities using his medical knowledge. That should not be done. Very good. Next.
Hello, sir. This is Meghana.
Meghana, tell me.
Yes. So, when there is a legal case involving a doctor in the court, and if he is witnessing it, he should be truthful. He shouldn't be like a false teller or something. He should be truthful. He should say the right things in the court.
Yes. So whenever the court summons, we should tell the truth. We should not supposed to tell the false or fabricated things. Very good. Any others? Any other examples apart from the?
Sir, I'm Manobna.
Your name is
Manobna.
Manobna. Please tell me.
Sir, like in every profession, there is a boundary line between personal and professional life. A
Okay.
doctor should also never mix up the personal and professional
Yes.
life, and he should never let anything overcome himself.
Okay. So we should not mix up the professional things with the personal things. Wonderful.
Yes, sir.
Next.
Sir, my name is Meghna.
Tell me, Meghna.
Am I audible, sir?
You are audible.
Sir, I think a doctor should not be proud of himself. He should be like humble always. And
So
he
you
should
should.
not do any mistakes
Yes.
while treating the patient. And when the disease is not curable like cancer, he should be like, he should not scare the patient. He should be like, he should try his level best, however much he can. He should not say, no, I can't do this, I can't treat
So
you
you
like
should
that.
not feel superior like God. So you should be humble. You should be reachable to the patient.
Yes, sir.
Yes, very good. Next.
My name is Sakshi, sir.
Sakshi, tell me.
Sir, if a doctor receives patients who have undergone domestic violence or sexual abuse, the
Yes.
doctor should respect the patient's confidentiality and take the right legal steps to help their patient.
Yes. So you are correct. So whenever there is a example or whenever there is a case of the sexual violence or domestic violence, we should treat the patient. We should maintain the secrecy, and we should inform the legal authorities. That is, the legal duties of the doctor is there. Very good. Next.
Sir, this is Vidya.
Ananya.
Sir, if the doctors don't have the enough confidence in treating a certain disease, he should not give a false hopes.
Yeah, it's discussed, right?
Better
Yeah.
tell them to consult another doctor instead of giving a wrong treatment.
Okay, you mean to say if you are not the right person to do that or treat the patient, you should refer the patient to a appropriate doctor.
Yes,
Very
sir.
good.
Yes, sir. Right, sir.
Yes.
Sir,
Yes.
sir shouldn't take over benefits of his profession.
Like example.
Example. The influence, sir.
Like.
It's
Someone is prompting, I think.
Hello.
Yeah, please tell me.
So that's what's the benefits. I am a doctor, give me this and that, like that.
Okay, fine. So there is one word known as dichotomy, fee splitting. So giving or taking the commission from the fellow colleagues is not right thing. Do you understand? So I am a surgeon, a patient comes to me, I refer the patient to the radiologist for MRI, and he will charge 10,000 rupees, and in that 5,000 rupees will be given to me. So that should not happen, which is happening nowadays. Do you agree?
Yes, sir.
Yes, sir.
Yes. Anything other than this?
Hello, sir.
Yeah, please tell me, sir.
Sir, the doctor should not ignore the emotional needs of the patients,
Okay. We
and he
should
should
not,
do not show off, sir.
like,
Sir, using cell phones while attending the patients, he should be face to face while attending the patient, sir.
okay, we should not use cell phones, right?
Cell phones. While attending some serious cases,
Yeah,
should not
yeah.
be in the call, sir.
Yes, you are correct. We
And
should be
should
dedicated.
yes, sir.
Yes. Any other examples?
Sir, this is Vidya.
Yeah, madam.
Sir, I think the doctor should communicate well with the patient like that of a family member so
Yes.
that he can diagnose the disease well.
So he should be approachable. He should be a good listener, so that the patient will open up. They will tell each and everything, right?
Yes, sir.
So very good. Any other examples?
Sir, this is Pooja Shri, sir.
Yes, Pooja Shri, tell me.
Sir, amniocentesis should be banned completely, sir.
Amniocentesis. Okay.
Yes, sir.
So have you seen any amniocentesis, or have you heard of?
Nowadays, yes, sir.
Are you talking about the abortion?
No, sir. By telling the sex of a baby before pregnancy, sir.
Yeah, yeah. So that is usually done nowadays by ultrasound. So that should not be done with the intention of aborting the female fetus.
Yes, sir.
Yes, thank you all. We have discussed almost more than 70 examples. So each example, if you quote, they amounts to unethical acts, or you can call them as the professional misconduct. You can call it as professional misconduct. Now, almost we have reached 10:40. So last 5 minutes. So what should be the punishment for these acts or these conducts? Do you understand? The punishment for this is, so if the act is small, if the act is not that grave, the state medical council will give the warning to the physician. The other punishments are, his name may be removed from the state medical council. So that means to say, if you cannot work anymore, your name will be either temporarily or permanently removed from the medical council. Is that clear?
Yes, sir.
So
Yes, sir.
there,
Sir,
so
I have a doubt, sir.
yeah, please, somebody was adding.
Yes, sir. Sir, so I told you amniocentesis should be completely banned, but when they take the amniotic fluid itself, they find out all these genetic disorders and everything.
Yes.
So once
See,
it's banned, what are the alternates used?
that's why I told.
Huh.
So,
Yes, sir.
so finding the sex by doing ultrasound or by doing the amniocentesis is legal if it is done to the to help the patient. So there are so many genetic disorders. So for that, if you want to detect the sex, that is fine. So if your intention is to kill the female feticide, or if your intention is to kill the fetus, that amounts to this thing, professional misconduct. So you can do it. Only thing is, your intention should be correct. You should be right. You should be doing right. Understood?
Yes, sir. Yes, sir. Thank you, sir.
So we have discussed some of the examples which amount to serious professional misconduct, and we have already also discussed the punishment for this. So any other doubts? So I feel there is no doubt, and the same topic will be again discussed when you come to the second year MBBS. And being the first year student, if you know this much, it is well and good. So is there any doubt?
Sir, what are the punishments if he commits a severe crime or something?
Like severe crime means what? What severe crime you would like to say? Murder?
Like making false postmortems or postmortem reports.
Yes. See, that is giving false certificates. The punishment is 7 years imprisonment.
Oh, okay, sir.
Along with that, your name may be removed from the State Medical Council register. So issuing any false certificate, maybe it be a postmortem certificate, may it be a sickness certificate, may it be a wellness certificate, anything, issuing a false certificate is punishable, and the punishment is 7 years of imprisonment.
Okay. And what if the sex of the baby is disclosed and
Yes. If the sex of the baby is known, and if that is under the PCPNDT Act, the punishment is 3 years.
okay, sir. Okay.
And there may be up to fine of 50,000.
Okay, sir. Okay.
So any doubts? So I think we should end this session, and I thank you all for your valuable inputs and your almost I was talking 10%, you all spoke 90%. So I would like to thank everyone, and I think we had a nice discussion. Thank you.
Thank you.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.